So before we developed the nursery, since this is a maternity hospital, we had a lot of high-risk cases. A lot of babies died, and there was no organized program. And so they wanted to start a nursery here, and this room was empty. It used to be the operating theater, and so we made it into a nursery. And at first we had no electrical outlets. We had extension cords running all over the place and things like that. And our modern equipment, which they had bought, kept getting ruined by the high power surges and irregular electricity. So we made this simple system with lights and reflectors to keep the babies warm, and developed and started using simple protocols from a pediatrician. And then babies started doing really well. And so now we just keep using the simple protocols that were written by this pediatrician, and these simple ways of warming the babies and things like that. And we've seen a lot of babies get better. And really now babies are coming from 70 to 100 kilometers away to be admitted in our hospital. So yeah, this baby was born about 10 days ago now. It was only 900 grams at birth, and usually babies that size never survive in this environment. In the West they would, or in a big hospital in Delhi or something, but here in this environment they don't usually survive at all. And plus the mother had so many complications before the birth, we thought for sure the baby would die before it was even born. So it was a miracle to have it born alive. And now it's 10 days old, and it's drinking by a spoon, taking feeds very well, and it's starting to gain weight. So this baby has really been a miracle baby since the start. The seeing mother's very dedicated. This is her first male child, and so they're very keen to have male children here because that's their social security system. The boys grow up and take care of the families, so every family wants to have at least one boy, so that they know someone will be there to take care of them when they get old. So they've lost every other male child they've had. So this is the first one that's lived, so they're very happy. We don't have any ventilators here to help them breathe if they have breathing problems. All we can do is give oxygen. And even then sometimes the tanks will be empty and it's difficult to get and things like that. So that's the most essential thing for small babies. Plus, keeping them warm is difficult because of the electricity here is so unreliable. So even keeping them warm is a problem sometimes. So in the West, babies that are even a pound, which is more like a half of a kilo, can survive. But here in this environment, it's miraculous every time a baby that's only 1 kilo survives. It's really a miracle.